This is the Veterinary Project Podcast, episode 36.
Welcome to the show created by vets featuring absolutely no pets. This is the Veterinary Project Podcast, hosted by Dr. Michael Bugg and Dr. Jonathan Leicht. Our resident veterinarians have swapped out their stethoscopes in favor of microphones to bring you the Veterinary Project Podcast, a show focused on real conversations, aimed to connect this amazing profession full of remarkable people. Through the sharing of collective stories and wisdom, and connecting over the many unique challenges we face, we invite you to join our community of veterinary professionals leading intentional lives. And now, here are the hosts of the Veterinary Project Podcast, Dr. Michael Bugg and Dr. Jonathan Leicht.
All right, welcome back, everyone, to another episode of the Veterinary Project Podcast. I'm already kind of laughing here because this is going to be a fun one. I don't really know where it's going to go. Jonathan and I were kind of pre-rambling. My personal goal with this episode is to get Johnny on some serious rants. So let's see if I can pull that off.
And I'm feeling it today, so I don't think it's going to take much at all.
Yeah, we've had to delay the recording of this a little bit. Jonathan's been running around, and then he was stuffing some sandwiches in. So it's busy times over there, it sounds like. Fill us in quickly, I guess, so we don't chew up much time here. Just on the clinic, where you're at, how that's all coming along.
Yeah, exciting times ahead. I was telling Mike already, this is the beauty of being in business, is that this morning I have been working on contracts, talking with a designer, multiple conversations with my contractor as to spacings, as well as where certain plumbing fixtures should go, where do shutoffs in a building go. This is not things that you think about when you're actually planning out a vet clinic or any other business, but guess what? You signed up for it, you do it, so I'm doing it, which is pretty awesome. And as we were speaking about previous, you got to have the right team. So really excited. We've got some people locked in, both in terms of doctors and techs, practice managers starting virtually May 3rd. Really excited. Candace in her last day of work today. She could not be more happy.
What?
Really exciting.
I didn't even know that. Oh, congrats to Candace.
Yeah, she gave her 2 weeks notice. Her president and her company was like, awesome. Congratulations. You are the right person to be moving forward. She wants to spend more time at home, help in the background. It's just fantastic. So there's a lot going on right now.
Okay. Well, this kind of inspired this episode. So another shorter edition with just me and Jonathan. We're going to dive into kind of some of the realities of veterinary medicine in 2021 as Jonathan is staffing up his own veterinary clinic. So before we jump into that, give us a quick tip and then we'll get rolling.
Excellent. Our quick tip today is a shout out to another podcast. They have no idea that I'm doing this, but I think anybody that wants to listen to innovation, and we're going to talk about this in today's episode, go check out the Veterinary Innovation Podcast. Sean Wilkie and Dr. Ivan, they put on a really nice short podcast. They are speaking with the innovators within our profession throughout North America and the world. Go give it a listen. Well worthwhile.
Okay, right on. Well, let's dive in, Jonathan. I know that you have been sort of aggressively staffing up your veterinary clinic, and it kind of sounded like a little bit of a matrix system here, trying to blend all the team members together. Everyone has different kind of wants and desires. So tell us a little bit about what that looks like. You know, as you're bringing on veterinarians, some want to work part-time, some want to work full-time. How are you balancing that? What is that looking like?
Yeah, great question, Mike. So firstly, you need to look at what your vision of the clinic is. And so working with both Bridgeline Vet Clinic as it gets going, as well as Mosaic Veterinary Partners, you're dealing with such a, like you said, matrix. I think that's a perfect analogy. There's such a design element in the vision of that practice that you really need to understand. And then you hit the reality, which just smacks you in the face of 2021 that goes, yeah, that sounds all great and dandy. Where are you going to find those people? Who are you going to bring onto your team? You want to create this culture. And then you hope that you have the influence, the connections, et cetera, to start having the discussion that you want with those that you think will fit well into that culture vision, which is really different depending on who you talk to. That's fantastic. So what we've been looking at is I've now had those conversations. They've been ongoing for months, but there's individuals that want to come in a part-time basis, which means that they have other wants, desires, hobbies, businesses in their life. And they're saying, Jonathan, I can't give you those full-time hours, but can we make something happen in a half-time role or a less than half-time role? That's an interesting dynamic. And this is something that you hold really true to, Mike, is wanting to work that 40, 50, 60 hours a week is not in everybody's forte these days. It's actually less and less if you look at it in veterinary medicine, and probably to our benefit. Giving people outlets to have other activities, hobbies, skills, businesses, etc., actually lead them, in my view, to being better veterinarians as well too. So in this dynamic, through our contract negotiations, we've really had to look at, what do you pay a part-time person? What are some of those extra facilities that can allow them to make a transition from a full-time role if they're in one now? And or if they're not, what's going to inspire them? What's the vision that you need to look at when bringing them into a new business like this? So it's been a great journey the last couple of months, and we're literally just finalizing pieces right now as we speak.
Yeah. I mean, and this is simply my personal opinion. I know everyone has their own on the whole part-time versus full-time. Is in the profession, when it's just full blast cases coming at you, you can be flawless with your, whatever you want to call it, self-care, like meditating, eating healthy, exercise, everything can be perfect, but too much volume is just too much volume. Like the only solution to over volume is taking a rest, like taking a break. So, I mean, seems like so many people I talk to want that part-time hours to have more recovery. So kind of with that, I mean, let's dive in. We were chatting.
Yep.
If you compare apples to apples, let's say you have two veterinarians working 2.5 days versus one veterinarian working 5 days, and they get paid the same, benefits are the same, everything's the same. The two part-time vets will actually cost the clinic more, right? Like in terms of onboarding and all the packages that fall in behind. So let's maybe kick this around for a veterinary owner and for associates looking at sort of pros and cons of part-time, what it looks like behind the scene.
Yeah. So if you look at it from a part-time perspective, you still have those overhead expenses. So when we talked about that in the P&L, if you're looking at an employee coming on, I look at it as an extra about 10 to 15%. I put a 15% on top of whatever that employee's costs are from a salary, production, extras basis, just for all of those benefits and extra perks that are part of an employment package in 2021. So if you look at two employees that are part-time hours to equal that full-time load, you're actually looking at another 30% extra because you have to offer them the same. Mm-hmm. And that's only for one position.
Yeah.
So if you need to then bring on multiple people and or there needs to be flexibility around scheduling, well, you still might not even have hit your full-time equivalent. So you have to bring on more people. So it does end up being a piece from an employer perspective. You need to really closely budget and you need to know your numbers. Mm-hmm. Really hard. It's a lot easier just to hire 1, 2, 3, 4 vets full-time. It's a lot harder to actually do that in 2021. And to your point, is less of a desire for many people these days.
Yeah. And so you kind of touched on it. One of the benefits is there is a little more scheduling flexibility, right? Like if you have two part-time vets, they can kind of plug and play a little different. If you have one vet and, they get sick or they're on vacation, they're gone, right? Like I know when I was working part-time, it worked well with the other vets because you can be more flexible. Yeah, with
agreed.
that.
And that's the best part of it. Let's put dollars to the sides. If you have that conversation right off the start, what does scheduling look like? Even for Bridgeland right now, we've not defined our schedules yet. And I've been really clear with our veterinarians at this point. We know what our goal is. We know what we want to get to, but those definitions of Monday, Tuesday, Wednesday are not yet in place. Mm-hmm. The vets are comfortable with that, knowing that they've all given what their recommendations and desires are, and knowing that we are going to fit them into as many of those slots as possible. And they've all said, hey, we're flexible within reason to the extras that they come in.
And just tangibly, what does that look like for you? How many full-time, part-time, and then do you still have gaps you need to fill?
Yeah, so it's a great question as well too. So we've got 2 part-times, and I'm hoping to have the full-time here right away as well too. And then, so that gives us 2 full-time equivalents off the start. I'm on the overflow. And then I hope within a year to have another one in there. This clinic is set up for 4 full-time equivalent veterinarians. And this is just on the vet side. We could talk techs and TAs and reception as well too, because that comes into it big time as well.
Yeah. Okay. I want to keep us tight here on for time here. So we have COVID coming along, increasing the needs of the clients, both, in terms of just the way medicine has gone. Clients want higher quality, which is totally understandable. And there's higher volume. Clinics need more team members to handle this increase in volume and increase in demand. But the way that we're seeing how many veterinarians want to work is they actually want to work part-time. So we have these two forces creating a huge gap. There is not a veterinarian that I know that is not looking for team members.
Yeah, it's difficult right now. We are not in an easy world. And the traditional model of just putting the ad out and somebody's going to appear, doesn't take long to look in the CVMA, AVMA, any of our ads to see pages upon pages. So you have to look at what else do you have to offer outside of the norm, whether that's through social media, whether that's recruiting agencies, whether that's really getting to the core of your business. So within Mosaic Veterinary Partners, we did a strategic meeting early in the year. And Becky Taylor, our director of recruiting and communications, said, okay, well, we're going to partner in with our group from a marketing standpoint, and we're really going to exemplify what we bring forward to mixed animal practice in Alberta, Saskatchewan, beyond. And here's why you would want to work with us as a team member. You have to do something different in this day and age. That comes into the innovation platform. That comes into exactly why you're doing your business. And you have to be leading with that each and every day. And that's not easy to do. I'll give you the perfect example. Multiple clinics right now where we're short of people. I would love to just be able to plunk in another 3-4 veterinarians within them, but it's just not possible. Those veterinarians don't exist. So then you have to look at other ways that you can help them out, whether that we're looking at after hours care. What does teletriage look like? What does telemedicine look like? What does the actual utilization of RVTs in practice look like? Becky Taylor is just loving what I'm saying right now because I am a converted member that says, how are we utilizing our technologists? In what better way can we utilize them based on the way they've already actually been trained? And even beyond that, that's a scope of practice we're deep into conversation with at a regulatory level.
Okay. I feel like this is an area I can press to get that rant out of you, but I do want to be respectful. I know you have lots of different interests. So I'll pivot. You're actively hiring for various clinics.
Yep.
What do people want? Associate veterinarians, when you sit down with them, apart from pay, and we've already touched on hours, what are some of those things they're looking for that's going to make them choose your clinic over someone else's?
Top of mind, mentorship and culture. What does the mentorship look like? And I'm speaking specifically for techs and vets. What does the mentorship perspective look like for them in that clinic? What does mentorship, what's the definition of it? What can they expect? And what's the follow through look like? And then secondly, from that, what is the culture of that clinic? Is there a toxic environment? What does the scale of different case load look like? And in certain dynamics, what are their expectations for after hours calls if we're talking mixed animal? That's a big deal. That's the CVMA survey that went out last year in terms of workforce showed emergency as being one of the number one reasons to leave practice due to that after hour call burden, something that we are intimately involved with from a Mosaic standpoint and trying to mitigate as much as possible. But that needs more. That needs all of us within the veterinary industry to be looking outside of ourselves and other ways of doing things, other ways of innovating, fostering technology to help our clients, patients, and the businesses, because all three of those come together. We're very much in that midst right now. There's my mini rant.
So, I mean, I don't know. Yeah, I'm not sure really where to take it.
I'll be simple with it. There are technologies to help us better access care and provide better care in a way that actually our clients can access us, as well allows to follow through the regulatory legislation that is in place on purpose, depending on where you're at. There's ways of doing this, and we need to look at it as a veterinary industry in a more forward approach. And there is companies out there that want to help us do that. We don't have enough vets. We do not have enough techs. People can counter me all they want. That's my view as an employer for a long time now. It's only getting worse. We have to look outside the box.
Yeah. And it is across all industries, technology is deflationary. What I mean by that is it's meant to reduce workload, right? So in this situation where we have this shortage of human capital, and we're trying to fill the gap, I mean, we got to start looking at other solutions. So if technology can come in and lower the gap, like from the demand side, take some of that workload off, it's going to have to be the way. Because I mean, we're kind of on a unsustainable trajectory from what I'm seeing right now.
Correct. Yeah, we're going to be releasing, in Alberta here, what that workforce study looked like in terms of the shortage of vets, shortage of technologists, and it's only going to get worse as our retirements continue to progress, as attrition within the industry continues to progress. But the positive side of me says animal health and the desire for money to come into this space and help grow it from a business standpoint and from a client standpoint who are owning more animals, we couldn't ask for better. That's really hard to say in a vet clinic where you're overrun in a day-to-day. But if there's ever that we had an opportunity, we have innovation happening. We have people that want to be in our space. We have people that want to spend money. Our supply and demand curve is overly healthy right now. Let's take advantage of that to the positive of our teams and then our practices as a result of it. We have to do that, or else we're going to get left in the dust. Plain and simple. There's people that are going to take it from us that don't have the same love and desire to ensure that veterinary medicine is to the benefit of our clients and the patients we look after. And that would be, to me, a disservice. And we would be letting it happen voluntarily. It's in our hands. Yeah,
kind of the choosing not to act, is making that choice to give it up.
Without a doubt. Love it.
Yeah. Okay. One last question for you. We had talked offline about this problem, right? This demand that clients want better care. We need more team members. And we were talking about how does this actually pencil out in terms of paying for it? If part-time vets cost the employer more, the only way to offset that is to bill out more, charge more to the clients as expenses go up. By and large, clients already feel like veterinary care is fairly expensive, or at least some clients feel that way. How do we navigate that, right? If costs are going up, if the industry is moving to in a way where it could cost more to staff, how do we get that value across to our clients, if pricing is going to be going up?
Couple of tactical pieces I can think of from an employer basis is the first is, what does that value from a communication standpoint look like? What are you training your team to do? It all starts with team. How does the team bring across the value of what you're doing as a veterinary team for those clients you're seeing? Because really, price is not the number one complaint, except for in the lack of value that is presented. Number one right there, communication. Number two, businesses are leaving money on the table. Look at what you're bringing in terms of inventory. Look at who you can partner with and go talk with those companies. They want to help you. They want you to be better communicators with your clients, because it then leads to more of their products moving out the door. It leads to more rebates. It leads to you making more in order to pay for that. Be efficient in your practice. Don't ignore the P&L discussion that we had 3 weeks ago or whenever that was. And leave thousands of dollars on the table for slippage, and then mean that you actually can't bring in that person because you can't afford it. And I'm using that in quotation marks, when you actually can and should. And then know what you stand for. If you don't stand for something and you don't want to innovate, then maybe you shouldn't be in the business.
I like it. I think I'll leave it there. I love when you get fired up and that passion in your voice, because I mean, we chat all the time, and that is the one thing that constantly comes up and through you is your desire to advance the profession without losing what it really stands for, right? Like, which is helping the clients and helping the pets.
Correct.
And sure, I know people listening to our podcast and we talk about money a fair amount.
Yep.
But it really doesn't have to do with the money. It's as you're saying, that unlocks those pieces where you can bring more staff in and support your team, provide better service, provide better value. So yep. I love it.
That's it. That's all I've got for today. Love it. Rant out. You succeeded.
Okay. Well, let's leave it there. Let us know, everyone, these little short episodes, if you're getting value from them. I feel like they're valuable. I love kind of putting Jonathan on the spot. Because I mean, he's in the thick of it, and bringing all that forward for you guys. So let us know, or if there's other topics you want us to dive into.
Yeah, no, and I think that's good, Mike. And I've had a few people reach out in our past episodes over the last month. And yeah, continue to bring forward some of the other topics that you think are important.
Thank you for listening to the Veterinary Project Podcast. As a recap, on behalf of our hosts, the Veterinary Project Podcast will be releasing new episodes weekly. So be sure to tune in as we bring you more conversations aimed at helping you enjoy a life well lived. If you enjoyed what you heard on the show and you want to stay in the know, please like, love, and or subscribe to the podcast on the listening platform of your choosing, as we're available on all the usual suspects. If you know of others that may benefit from these conversations, we'd love it if you please share the show with them, as this will help us grow our community to reach more and more veterinary professionals. Speaking of which, if you are a veterinary professional and would like to get connected with more like-minded individuals who are joining us on this journey, please send an email to the veterinaryprojectpodcast@gmail.com, and we'll invite you to be a part of our private Facebook group. General feedback, requests for information, or perhaps requests to be a guest on the show can also be sent to the veterinaryprojectpodcast@gmail.com. Dr. Michael Bugg and Dr. Jonathan Leicht, thank you for listening to the show, and we'll catch you again next week for another episode of the Veterinary Project Podcast. Bye for now.